The reason why I started Cierra Sisters is 27 years ago, I was told that I did not need to get a mammogram because I was a Black woman, and breast cancer didn't happen to Black women. Unfortunately, what I found out was that Black women were dying at an alarming rate, and the doctor didn't want to give me that mammogram and told me to come back in 10 years. Well, I pushed for a mammogram and demanded one. When I found out that I had breast cancer, it was on my 35th birthday.
After hearing Bridgette, it's a story that's not terribly unfamiliar, in that we know that Black women are diagnosed with more advanced breast cancers. And there's multitudes of reasons, many of which reflect some of the problems of structural racism in our society.
As Black women, we just have to fight harder than anybody else to get the care and services that we need.
Access to screening is not as easy. Insurance coverage is not as widespread. Biases and perceptions among physicians, providers, and patients is sometimes difficult. All of these elements conspire to make outcomes clearly worse.
Had I been a Caucasian woman, I think that maybe I could have gotten some of the process started and diagnosis made a lot sooner.
There's no question that we have seen both implicit and explicit bias in healthcare across the United States. I certainly hope that we will see ever less of this, because cancer does not discriminate. Cancer is an equal opportunity disease.
Even though we've come a long way in our country, there's still racism in our healthcare system that needs to be addressed in a systematic way before we can really see better equity in outcomes.
I think my delays have been a combination of both being Black and also the assumption that being a Black woman without insurance, that my financial status is something that it's not.
When it comes to the financial impact of cancer, there's definitely evidence that individuals who are lower income or individuals who are not white, specifically Black patients, are at greater risk for facing some of these financial challenges. And that ties into a lot of the existing and systemic inequities in our society.
They should have talked to me a little more in depth. They should have found out exactly what was going on and be more caring about it or more concerned like I was.
Oftentimes when we do have to push the envelope, we are deemed as the angry Black woman.
I had to get irate with the doctor because she wasn't trying to hear me. And so I had to let her know, you're gonna hear me and this is what we're gonna do, because I'm not gonna wait.
None of our patients should have to fight our healthcare systems while also fighting for their health and wellness.
We can make advancements in treating cancer, but are we making advancements in disparities and inequities? And we can see that even though treatments are getting better, disparities necessarily are not.
We know that the complexity of care, the burdens of care, the burdens of this disease on you and your family is enormous. When you then think about the added challenge of dealing with racism and other issues in our society which make it difficult to be able to be your own authentic self, we know that's hard.
There's been so much racism against Black women trying to get mammograms, trying to get diagnosed, trying to get into clinical trials, that I've had just about enough. The brave is calling out, please make a change so no one else has to deal with this.
We're producing this series with Bridgette Hempstead and the Cierra Sisters to address racism that's happened in both research and cancer care.
It's important that we do come together, because at the higher level, policy needs to be changed so that there's no tolerance of racism. The voices of the survivors and caregivers need to be heard so they understand what the problem is. Together, we continue in this fight and bring change. The narrative will change.